Face masks are essential tools in infection prevention, particularly in surgical settings. They serve as physical barriers to minimize the transmission of infectious agents between healthcare workers, patients, and the surrounding environment. In surgeries, where the risk of contamination is high, face masks help maintain sterile conditions and prevent cross-contamination. Their effectiveness has been widely recognized in reducing infections caused by respiratory droplets and aerosols. How face masks work. Face masks function by creating a barrier that filters out particles, including pathogens such as bacteria and viruses, from the air. Surgical face masks typically consist of 3 layers. 1. Outer layer repels water and fluids. 2. Middle layer filters pathogens and particles through electrostatic or mechanical filtration. 3. Inner layer absorbs moisture from exhaled air. These layers work together to trap infectious agents in respiratory droplets, preventing their spread to the surgical field or other individuals. They also reduce the wearer's exposure to contaminants in the environment. Types of face masks. Different types of face masks are used in surgical settings, each designed for specific purposes. 1. Surgical masks, composed of 3 layers. Protects against large droplets and splashes. Primarily prevents the wearer from spreading microorganisms to the sterile field. 2. N95 respirators. Offers a tight seal around the nose and mouth. Filters at least 95% of airborne particles, including aerosols. Used in high-risk surgeries or procedures involving aerosol generation. 3. Powered air purifying respirators, PARs. Uses a blower to pass air through filters before delivering it to the wearer. Provides high-level protection in surgeries with significant exposure risks. 4. Cloth masks, made from layers of fabric. Less effective in surgical settings, but may be used in non-sterile environments. 5. Face shields with masks. Combines a face mask with a transparent shield for additional splash protection. Often used in combination with surgical or N95 masks for enhanced safety. Choosing the right type of face mask depends on the nature of the surgery, the risk of exposure, and the level of protection required. Viral and aerosol infections prevention. Face masks are particularly effective against viral and aerosol-transmitted infections in surgical settings. 1. Droplet transmission. Many viruses, including influenza and SARS-CoV-2, are transmitted through droplets expelled during coughing, sneezing, or speaking. Face masks block these droplets from contaminating sterile surgical equipment or wounds. 2. Aerosolized particles. In surgeries involving high-speed drills or lasers, aerosolized particles containing pathogens can remain suspended in the air. Masks with high filtration efficiency, such as N95 respirators, can prevent inhalation of these particles. 3. Prevention of post-operative infections. Face masks reduce the risk of surgical site infections by limiting the transfer of microorganisms from healthcare workers' mouths and noses to the sterile field. Protection of healthcare workers. Healthcare workers in surgical settings are at constant risk of exposure to infectious agents. Face masks provide several layers of protection. 1. Barrier protection. They shield healthcare workers from bloodborne pathogens and bodily fluids that may splash during surgery. 2. Reduction of inhalation risks. Masks with high filtration capabilities protect against inhaling infectious aerosols, particularly in cases of airborne diseases. 3. Reduced cross-transmission. Face masks minimize the risk of healthcare workers transmitting infections to immunocompromised patients. The use of face masks, when combined with other personal protective equipment, PPE, forms a critical line of defense in ensuring the safety of healthcare personnel. Risks of wearing face masks. Despite their benefits, prolonged use of face masks in surgery can present some risks and challenges. 1. Physical discomfort. Extended mask use can cause discomfort, skin irritation, and pressure sores on the face. 2. Breathing difficulties. Healthcare workers may experience difficulty breathing, particularly when wearing tight-fitting masks like N95 respirators. 3. Communication barriers. Masks can muffle speech, making communication in surgical teams more challenging. 4. Moisture accumulation. Prolonged wear leads to moisture buildup, reducing the mask's filtration efficiency over time. 5. Incorrect usage. Improper donning, doffing, or reuse of masks can increase the risk of contamination. Proper training and adherence to guidelines are essential to minimize these risks. Conclusion: face masks play a vital role in preventing infections during surgery by acting as a barrier against pathogens. They protect both patients and healthcare workers from infectious agents transmitted via droplets, aerosols, or bodily fluids. While face masks are indispensable in surgical settings, it is crucial to address the challenges associated with their prolonged use. Adhering to proper protocols and combining face mask use with other preventive measures can ensure optimal infection control and safety in surgical environments.